right, thanks Jenny, and good morning everybody. My name is Hillary Warren, like Jenny said, and I'm one of the industrial hygienists here with our consultation program. And like Jenny mentioned, we've been sort of keeping track of some of the recent announcements that have come out regarding engineered stone and cases of acute and accelerated silicosis that have been taking place worldwide. And given our sort of expertise with regarding silica, the monitoring that we've done through the consultation program, and the assistance that we've sort of provided to stone fabrication shops, at least here in Georgia, over the past decade or so, we wanted to get in front of y'all quickly and provide some of this new information. So hopefully you can see the screen, and even if you couldn't, you could open that link and there's going to be a PDF to these slides. And the reason we wanted to provide them as PDF is that there are hyperlinks that are in the presentation to link you to additional content that you might find helpful at the conclusion of our time together today. So the first thing is, wanted to move us. Just some content acknowledgements. Like I said, this is sort of a new, late-breaking, at least in terms of its urgency, information that we wanted to share. And so there have been a couple of recent webinars that our group has attended. One took place in May and was put on by NIOSH, the National Occupational Research Agenda Respiratory Health Cross-Sector Council. And so that recording is available. You can see there if you wanted to follow up. But some of this content today is going to come from that. There has also been a good deal of information coming out of Queensland, Australia, because this is really where the sort of epidemic was first noticed, and we'll get into some of their statistics, but they have a series of videos that they produced during a presentation that they gave to the stone fabrication industry and workers and owners, and so those videos are available there as well. And some of you may have heard at the very beginning of this month on Morning Edition on NPR, a segment that they did specifically talking about kitchen countertops and engineered stone and the hazards related, so we've linked to that as well. So what we're going to cover today in the next hour or so is just sort of to hit some highlights and summarize some of the concerns around engineered stone that you may have heard recently. So we're going to make sure everyone's on the same page. What is engineered stone? Why are we talking about it? What do we know so far about these acute cases that are showing up? And what is being done? You know, one of the quotes that I sort of heard from one of the physicians that did a presentation on this already was sort of just drawing attention to the fact that, like Jenny mentioned, you know, chronic silicosis is something that we talk about when we're thinking people have had exposure maybe at a low level for a very long period of time, and that if they're going to develop disease, they don't develop disease until much later in life. And the harsh reality with what's going on now is that this disease the acute disease is affecting younger workers, you know, folks in their 30s, people with wives and dependent children, and is cutting the legs out from under them and their ability to work and provide in their very early working careers. So we want to know what's being done so far, and really what can we do, whether we're attending today as consultants or research personnel or owners of a company or workers at a facility, or you know somebody that's working at a facility that uses engineered and natural stone. We want to highlight what are some real practical things that we can do next. So the first thing that I wanted to make sure that we covered was just sort of why are we even talking about engineered quartz stone? You know, we I guess in our consultation program over the past 15 years or so, we've had a significant number of groups that have come in and asked for help with looking at their granite countertops or bench tops, as it's called in Australia. And OSHA has done a fair number of inspections in the stone fabrication NAICS code, but not necessarily that is honing down to just look at engineered stone, right, Jenny?
That's correct. And over the past several years, when we've been doing air monitoring, we started noticing spikes when we were doing monitoring at countertop companies, not really taking into account that it potentially could be something different than marble or granite. And it really occurred to us when we started getting the results back from the labs that this engineered stone had such a higher content of quartz.
Yeah, so it's really increased, at least in the United States, in popularity significantly. I think the numbers from the NPR Morning Edition stats were sort of around from 2010 to 2018, imports of engineered stone rose about 800% here in the US. And the reason being is for those of you that work in this industry, you know that this material, this sort of engineered or agglomerated stone or any of the brand names that it comes under, you know, Corian, that type of thing, is that it's really durable. It doesn't stain. You don't have to seal it. It's got a really nice consistency. It doesn't have pores, so you get less bacterial growth, so it makes it really attractive to folks for their kitchens and in the hospitality areas, you know, hotels, etc. It's abundant, you know, and really it's supposed to have a lifetime sort of guarantee. You don't have to replace it. The difference between this engineered stone and what's happening with natural stone is that the basic formula is somewhere between 85 and 95% quartz aggregate, all right? So you have quartz natural stone, and then you add together with that this polyester resin, and then you get engineered stone. So, you know, one of the questions that I think we get asked is, well, it's all rock. What's the difference? And the reality is that granite, you know, slabs and that type of material that we were sort of originally focusing on installing in kitchens and bathrooms is granite is somewhere in the range of, you know, 20 to 40%. Its content of crystalline silica is around that sort of mid-range. And here on this slide, you can see sort of the approximate silica content of different materials that we might find being fabricated for use. And down there at the bottom, you can see artificial stone is where this is the difference, is that we're talking about a product that is, you know, somewhere between 85 to 95% crystalline silica. So the content is a lot higher, and that means whatever amount of dust is produced, the vast majority of that dust is actually going to be crystalline silica. So for those of you that are not familiar with industrial hygiene and all of the terms that we might use, we wanted to pause for just a second and make sure we were all on the same page with regards to some of the acronyms and definitions that we're going to be using and referring to throughout this presentation. So we've got silica, and there's crystalline silica, which is naturally occurring, and there's a couple of other types, but the one we're really concerned about here is quartz silica, and specifically respirable quartz silica. This is what is currently regulated by OSHA here in the United States, okay? And so this diagram here on the right is just trying to give us a little bit of visual perspective to what respirable means. And respirable dust means, or respirable particulate means, that you cannot see it with the naked eye. It is of such a small size that you've really got to sort of consider expanding your field of vision like a microscope here. And so if you looked at this tiny little dot over on the right hand side, that's, you know, going to sort of, that's even bigger than a human hair is. But let's just pretend, right, that single dot right there is a strand of human hair. And as you start to work your way up in magnification, what we're really concerned about is dust that is, you know, a fraction of that. So here we're looking at things that might be in a particle size of you know, 1 to 10 microns in diameter across, all right? So a single particle being really small. And that's what that little down there on the bottom of the slide means. And so we're talking about things that are a millionth of a meter across in diameter, all right? But you're also going to hear about exposure limits and exposure values. or OELs and PELs. And here's where we switch from talking about things in diameter to things in terms of concentration of that dust particle in the air. So now we're going to talk about mass of dust in a given volume of air. And so that's going to be denoted by that UG over M3, that stands for micrograms per cubic meter of air. And all of the exposure limits that OSHA has set as law and levels that other organizations might have, like that threshold limit value that's shown there as a TLV, all of those things are talking about how much dust in a given quantity of air can an employee breathe in a workplace and be considered in compliance with the law. All right, so notice that we're not saying that that's the safe level, all right, but we're talking about what's in compliance with the law. So that's, if you hear us refer to these terms as we go through the presentation and you have questions, again, you can come back to sort of this section to look at definitions. So the other thing that we really need to clearly define here is silicosis. And this is what we're really talking about in this presentation, but I am going to highlight that there are other illnesses and diseases that silica exposure is connected to. So silicosis is strictly a lung disease, a pulmonary lung disease, where we've got fibrosis and scarring that takes place down where gas exchange occurs in the lung. And so that's that diagram there on the left of the respiratory system, where once you inhale those really fine particles of dust, speaker. Hopefully y'all can still hear me.
Can you guys still hear? We might need to remute everybody. Sometimes when people join later, it unmutes people. Okay.
Someone just type in the chat box, if you will, that you can still hear us, since we.
I can still hear.
Okay.
Okay, good, because I have it silenced, but sometimes we get unsilenced people. Okay.
Okay.
Sorry.
So that's fine. So we've got, once we inhale these particles and they get down to the lung and they can't come back out, the body's immune system tries to react and clear the dust particles out, and since that can't occur, those particles are encapsulated by our immune system and put into sort of the lining of the lung, and then those cells die, and that creates scarring, which is we're also going to refer to as sort of fibrosis here. And you can see the chest x-rays where you're going to start having sort of simple silicosis or more sort of chronic silicosis, limited sort of scarring, but still we need to know silicosis is not curable, right? And if we get to the acute silicosis or complicated silicosis phase, really the only thing at this point that's available for treatment at that level is a lung transplant. So things that are out there when we get into this nodular pulmonary fibrosis and scarring, what typically will start is shortness of breath and chest pain, a loss of appetite, maybe unexplained weight loss. Folks will have chronic cough, skin discoloration, and that's really going to be because you're going to not be able to transfer oxygen as well. So you start to have less red blood cells moving around the body. And then we've got silicosis that can show up and has to be formally diagnosed by a pulmonary physician through really looking at a specific type of x-ray. You've got acute silicosis, which is going to develop rapidly after a high level exposure and show up with symptoms and or even a formal diagnosis within weeks to relatively short number of years later. Then there's accelerated silicosis, and those symptoms are going to be the same, sort of with the shortness of breath and the chest pain, et cetera, but the clinical and radiographic progression, right, what appears on an x-ray or a CT scan is going to be more rapid. And chronic silicosis is really what we're more familiar with in terms of lower levels of exposure taking a long period of time, potentially before you show up with symptoms or even a diagnosis. There on the right side of the screen, though, we did want to draw attention to the fact that there are other illnesses that are tied with silica exposure. And so chronic obstructive pulmonary diseases, those lung diseases that we know, such as chronic bronchitis or emphysema, are known to be connected with silica exposure. Silica, crystalline silica, is a known lung carcinogen, so it is known to cause lung cancer, and it is also tied with kidney disease and autoimmune diseases such as rheumatoid arthritis and lupus. So we put those out there because they're going to show up again for us when we start talking about medical surveillance that's required under the OSHA standard. We did sort of want to draw attention to this study that has come out regarding acute exposure and acute silicosis. And what they found is that short duration, high concentrations, so here we're talking greater than 2 milligrams per cubic meter of air as a concentration, is 3 times more damaging as a cumulative equivalent to that would take place over a very long period of time at a lower exposure level. So even if someone's not performing a task for their whole day, if they had a really high exposure for a shorter period of time, and we did that repeatedly, that is something that we're going to be concerned about beyond just sort of a long-term lower level exposure. So now that hopefully we're all sort of on the same page about the material that we're talking about and the illnesses that it might be associated with, and those that it's known to be associated with, we want to dig into the artificial stone-related silicosis element here. So the timeline is that that sort of the first cases and the first studies that highlighted, hey, there's a connection between engineered stone or artificial stone and silicosis, came about just about a decade ago. And the first study came from Italy, and the cases that were showing up there for folks. And then the next year, that was expanded, and they started seeing illnesses coming in when they were doing sort of a retrospective look back and observational study of folks that they knew were exposed to this particular material. We were starting to see there's definitely a connection here.
Yeah, and that particular study was done at one small business. So this is a small business where 54% of their workers develop silicosis out of 11. And that's, when we talk about OSHA consultation and what our purpose is in terms of going out and helping small businesses with compliance, these are the issues that we really want to promote in terms of preventing this from happening to other small businesses.
Yeah. And so you can see over the next several years, we started to see more cases internationally from Spain, Italy, and then most recently starting to come out in Australia, and specifically really in Queensland, Australia, that they were seeing a number of concerning cases because we were looking at things that were accelerated cases or acute cases. As you can see there in Spain, the median age of the folks that were being diagnosed was about 33 years old. So here we're not talking about chronic silicosis where people have been working for 20 years. We're talking about where people have been working, maybe 5 to 10 years, and we're starting to see a concern. So, the Australia sort of popping off of that last slide and looking at 2015, they started looking in much more detail and did really sort of a full investigation of looking at all the different shops there in Queensland that were known to work with fabricated stone. So they did an evaluation and found 137 and now updated most recently to 169 cases, again with the average age of the afflicted being in the mid-30s. Israel has been using engineered stone, working with engineered stone 15 years longer than Australia, and that they're continuing to track an increase here in silicosis, and that between 97 and 2012, when they did sort of a look back, they found that 4% of the lung transplants that had been conducted during that time period were as a result specifically of people developing silicosis from working with engineered stone specifically. So engineered stone, not natural stone. So what's happening here in the US? The first case in the United States was diagnosed in 2014 in Texas. The 37-year-old Hispanic man who died 4 years after his diagnosis. Then we started seeing cases in California. Public health workers there did a search of hospital discharge records and found 4 workers from one company who have developed or died from silicosis. Colorado has identified an increase in silicosis cases, and again, being tied specifically to engineered stone. Washington State has reported cases at this point. And the concern here, to just sort of go back and touch on what Australia is finding, Australia's found that at least 12% of the workers who cut stone countertops have silicosis. And so what that means for us here in the United States is if we are going to estimate that we've got about 8,000 stone fabrication businesses in the US and about 100,000 workers in this industry, that we're not seeing yet what the true scope of this problem is likely going to be. And the thing that we kind of also need to remember is that even if we said, let's just stop working with engineered stone right now, right? And that is something that Australia is actually looking at doing. If we just said stop right now, because of the progressive nature of the disease and because there is some latency to it, we're still going to continue to see cases emerge and probably not reach a peak here in the US for 10 years or so. So this is something that needs attention, because even if we modified everything that we're doing as we handle engineered stone tomorrow, we're still going to see cases emerging. So we need to be aware of what those symptoms are and what are some of the things that we can be doing to address them.
And just to add something, I think one of the most profound elements of the MMWR article that prompted sort of this response and the NPR news article is that most of the patients had comorbidities. So they had other illnesses. They had rheumatoid arthritis, they had TB. And so there is the true potential that there may be many more cases of silicosis out there. They're just being misdiagnosed by pulmonary specialists that may not be doing work histories, or they may not be analyzing the x-rays by a NIOSH certified B reader or having them. So this potentially could be it will probably be a much larger outbreak.
I mean, part of our challenge here in the United States is that silicosis is not a reportable condition in every state. And I think there's actually only a couple of states that are required or currently do submit data to the Centers for Disease Control to report cases that are identified. So we're really lacking here in the US in terms of a tracking system when it comes to lung disease and specifically silicosis. So it's really upon individual doctors and individual public health workers in individual states to sort of connect the dots and hopefully on our end, on the industry side of things, and on the regulatory side of things to just be more aware and get the word out. So past and present, right? This is not new. When those cases did start to emerge internationally back in 2015, OSHA and NIOSH at that time published together a joint hazard alert. And I remember this coming out. And so this publication is available. You know, it's a sort of several page PDF that addressed, hey, we have a hazard that's identified here when people are working with this particular material. The thing about this hazard alert that you will note is that it was published prior to the 2016 new OSHA respirable crystalline silica regulation. That's what that RCS stands for. And so the permissible exposure limits and some of the required compliance elements that OSHA put in place weren't addressed in this hazard alert. So while the information on the hazard itself is correct and appropriate, and some of the control strategies that are mentioned are certainly still applicable, from the regulatory perspective, it didn't include some of the new things that came out in the 2016 standard release. So our current reality, both locally and globally, is that yes, we have a standard now, and our group has been working with construction and general industry folks, over the past 3 years, really intensely trying to get people to understand what the regulations are and what are the control strategies they should be using. But we also need to highlight here that even though there is a specific standard, that permissible exposure limit is acknowledged still to be not protective enough for workers. So if as a business you are only achieving the PEL in terms of concentration of respirable crystalline silica in the air, that we still would always want to encourage you to go further than that, because there are identified health risks still at the PEL. We are still waiting for an OSHA emphasis program. So prior to the standard being released, for 20 years or so, there was always either a national emphasis program or a special emphasis program that OSHA had in place that sort of allowed OSHA compliance officers some teeth to go in to various facilities, outside of a complaint or outside of a fatality event taking place, and look specifically for this hazard and the control strategies that were being used. And we're still waiting on that now. There's not currently an emphasis program that is active. And so that means that the likelihood of an inspection at a facility that works with natural or fabricated stone is lower than it would have been when there was an emphasis program. And so ultimately what that means for me, like real talk, is that the employers and employees have to take the initiative to understand the hazard and implement their own corrective actions, right? We're not going to be relying on waiting for an OSHA inspection to tell us that we need to change something. This is an acknowledged, recognized hazard at this point that we need to just move forward individually on trying to figure out ways to prevent, because the goal here is to prevent, not to treat. Once someone is diagnosed with silicosis, like I said, there's minimal therapies that are available, and so there is a need for continued research to look into treatments, because this is something that people are still going to be suffering from and showing up with disease from. And so there is important research into lung transplant or experimental treatments or total lung lavage, right, where they're going to sort of wash out the lungs. And we need to know how effective those therapies are, because they may benefit other people as disease continues to emerge. But we all know it's going to be a lot easier to prevent rather than treat. And so that's really the focus of the remainder of our time together today. So in terms of what can be done, we're going to start with the OSHA regulation for general industry. And the first thing is that we got to know where we stand. We have to know what are our exposures in our facilities. And an exposure assessment can include air monitoring, and there's a requirement that this has to be performed. But it can be performed in a couple of ways. So you can either use other people's data, all right, and this is called objective data. If you can document that the materials that you're referencing are similar or identical to the materials and tools and equipment and control strategies and duration of time and tasks are the same or very similar to yours that you might perform in your own facility. So there's objective data out there, and we can speak more to that later if there's specific questions. You can also collect your own data, all right? So you can have air monitoring performed at your own facility, and if you're a small enough shop, right, you can call on your state OSHA consultation program, right, who Jenny and I work for, to provide assistance in monitoring. Some insurance companies will do monitoring. So there's other ways to obtain your sort of real time, what are we being exposed to? There's a requirement to notify employees of what those results are. And what you want to be looking at are all of the different tasks that might be performed in your shop. Okay, and so here's the bulleted list of things that we have seen out at stone fabrication shops. You know, you have people who are going to wet cut, and then you have polishing and grinding, there's cleanup. In some instances, there is dry cutting. You know, there'll be certain applications where we've asked shops, you know, how do you perform your tasks? And they'll say it's all wet. We do everything with water. And then we'll go into a small room in the back, kind of as you can see pictured here, and they'll say, oh, right, except for this only has to, you know, take like 5 minutes. We need to cut sort of a groove here on this one side. And so sometimes things will be performed dry. And so what we want to highlight here is that the air monitoring or the exposure assessment that's completed really needs to include all of the tasks that take place at the facility. And what we would recommend is looking at not just the people performing fabrication, but people that are also doing material handling and moving things around on the shop floor. Some of the studies we'll look at here in a second, you know, we're looking at forklift operators or folks that were sort of out on the floor, but not necessarily doing fabrication, and they still had exposures. And so what you're going to do with all that data, or what you're going to do with all those numbers that you either reference from someone else or that you collect yourself, is compare them to OSHA's permissible exposure limit and the action level. And so here's where we're coming back to those concentrations of respirable crystal and silica that are found in the air. Air monitoring has got to be performed on the person. So you can see that in the little illustration of the guy, but also in the photo there on the lapel of both of them, you can see a device, and that's used to collect an air sample, and then that concentration gets compared to these PELs. And again, just a reminder, when we're talking about things like micrograms, we're talking about millionths of a gram. So you can see that sort of photo there on the left where you can tell it's definitely a piece of money, right? So it's going to be a dime, and the piles of powder next to it, that's 1,000 micrograms of silica, and what we're talking about is 50 micrograms of dust, sort of as your average amount in the average amount of air you might breathe in over the course of a day at work. And so that's what that volume, if we're sort of talking about amount of air in a room, so 20 cubic meters of air, right, might be what we're assuming someone under regular conditions would breathe in over the course of a day. Okay, so once we know what we've got for an amount in the air, whether we're going to take someone else's information through some of the studies that have been completed, or NIOSH health hazard evaluations that have been completed, or we collect our own and we compare it to that number. If we're over that action level, or we're over that PEL, then we're going to need to start thinking about control strategies. And so the first thing we would need to do is understand that if we're over the PEL, then we need to restrict access into those spaces for people. And so that means we've got to establish these things called regulated areas. So we're going to mark off the area. There's standardized warning signs that need to be posted. We're going to limit access into and out of those places. And most importantly, we have to provide and require respirators for people to wear when they're inside that regulated area. Okay, so we're going to start there. And then the next thing is to look at this hierarchy of control. That's this triangle that's here on the left. OSHA and industrial hygiene best practice requires us as business owners to start with the hierarchy of controls. And the goal is to either eliminate or reduce exposures with a top-down approach. And so the goal is to minimize risk by the sort of most effective and efficient means possible. So here's where we're going to start talking about engineering controls, and what's been found for this industry is water and local exhaust ventilation, sort of at the top of the list in terms of control strategies. But in partner with that are these work practices that we have to complete. You can't just buy the best engineering control equipment and put it out there and expect it to work. People have to be trained on it. There has to be preventative maintenance schedules set up in place. It needs to be inspected. Folks have to understand how to use it. And included with that, we're going to talk about medical surveillance. And then at the bottom of the tier, we're going to talk about respiratory protection and what that means. And I'll just introduce this concept here that unless you have exposure monitoring data that says you are below OSHA's permissible exposure limit, I would assume at this point, given what we know about engineered stone and the data that has come out, you need to assume that you are over that permissible exposure limit. And even if you are using water or local exhaust, we're going to think that we need to be supplementing with respirators here at this point. So we'll talk a little bit about that as well. So we've long known, right, that using water and different surfactants to reduce dust is effective. And I think it is a remarkable success for this industry that probably over the past 10 years, I think a lot of the stone tool manufacturers of the equipment itself have moved primarily to water-fed equipment. I mean, I think both Jenny and I, our experience with consultation, when we first started 15 years ago, it was all dry. The initial cuts were made dry, the sinkholes, the faucet holes, everything was dry, and we've really seen a transition to almost entirely water-fed equipment. So that's a huge success. But what we're now learning about engineered stone is that because of the tremendously high silica content, right, that 85 to 95% quartz in these products, water is not necessarily enough for adequate control for certain fabrication tasks. So here we're going to cover sort of the 4 recommended control strategies that are currently under investigation. And these, again, were presented during the NIOSH NORA webinar that we acknowledged at the beginning, and some of the Queensland, Australia references that you'll see throughout here. So the first one we're going to look at is sheet flow wet cutting. We're going to look at combining together local exhaust ventilation, or LEV, and wet methods together. So putting both air volume changes in a workplace together with water at the same time. Looking at isolating work sort of in a booth, which we've seen in various places. And then we're going to address cleanup as well. So first, sheet flow wet cutting. NIOSH, the National Institute for Occupational Safety and Health, addressed this in their webinar, and it's currently sort of under continued investigation, to my understanding, because they're still looking at developing and improving this particular approach. Because while they found a really dramatic reduction to below the permissible exposure limit for silica, it didn't get below the action level. So in this instance, if you were doing wet polishing or wet cutting or wet grinding, you would still continue to do that, but you would also flood the surface of the stone top at the same time. So water would have to be flowing across at the same time. And the methodology for how this was completed is variable at this point in time, right?
Right.
The challenge, I think, with that particular approach is that, I think while a lot of the shops that we've seen are equipped to do wet work, this would be on a different scale. And so that might require some changes in the facility structure, water retention and recirculation, filtration systems might be a little bit different.
And I think one of the challenges we see when companies go from working dry to adding water is that drains and flooding on the floors can also be a challenge, which we'll talk about later. But I've seen a lot of clogged floor drains. And when you increase the amount of water, that's also a greater potential.
Yeah, that's a great point. Okay, so the next is sort of exploration into how do we combine local exhaust ventilation and water use together at the same time. So here, this is data and recommendation that came out of a NIOSH health hazard evaluation, or HHE, that was completed a few years ago at a facility, manufacturing plant that had about 38 production employees. You know, they worked 8 to 10-hour shifts. This was in Texas. They processed about 100 to 160 pieces of stone a day, and they did both natural stone and engineered stone. And the researchers that responded to this invitation from this company, right, the company invited NIOSH to come in and do an evaluation of their process. This company was already using all wet methods. They had no dry work activities taking place at all. And so the researchers were on site for several days, tried to do both full day shift air monitoring, but also looked at very task specific things that took place with grinders. They tried to differentiate between when folks were working with the engineered stone and with the natural stone. And they did find some differences between exposure levels coming from folks that were using the pneumatic wet polishers that were equipped with diamond cup wheels, right? As you can sort of see the picture there on the left, and the pneumatic wet polishers that have the sort of replaceable resin polishing discs that come in different grits, right? Both of those grinders operate at different speeds, right? So different revolutions per minute, and they saw some differences there. The bottom line is that they found, you know what, we need to combine water and local exhaust ventilation in order to really reduce exposure below the action level. And so again, you'll note that this investigation took place prior to OSHA's promulgation of the new rule. And so if you were to click on this link and look at the report itself and look at some of the data, you'd see that they did some testing for folks that did lamination. They looked at a CNC operator. They looked at material handlers in the shop as well. And while they found those folks below the PEL, that was before the PEL was changed. And so now, if we looked at it through the lens of sort of the new lowered levels that OSHA has put forth, some of those other job positions were found to be over the action level. So this is where I think Jenny and I in consultation would really recommend that, you know, we would want to do monitoring for other folks out on the production floor besides those that were just involved with fabrication, just to make sure that we've got an idea of where those folks' exposures are at. One of the other things that they noted, and I put here, is that, you know, a lot of the equipment that obviously is water fed has control knobs on it. And those control knobs are available for employees to adjust. And so we know that if something's available for an employee to adjust, they often will. And that can either be a wonderful thing or it can be something that could be detrimental. If we're turning down the amount of water that's being used, that might result in a higher exposure. So that's just something to keep in mind when we're looking at evaluating work practices.
And if I can just jump in, I know that the general industry standard doesn't have a requirement for a competent person. But the concept of having a competent person, someone on the shop floor that is capable of sort of monitoring passively all the engineering controls, making sure that they're operating and functioning properly, and then to coach the employees to make sure that they're using them properly, would be very beneficial to making sure that you're not wasting all this money on control measures and then them not being used effectively.
Yeah, great. This is sort of a follow-up to that NIOSH HHE, This was an exposure study that was done, and you can see the link there below if you wanted to look at the document specifically, where they did some evaluation between wetting the saw blades or the grinding wheels and then supplementing with local exhaust ventilation. And again, here's where they were finding the best reduction came when you paired those two things together. Things that need to be noted, right, are placement of the duct. So you can see in this photo that the employee actually has his left hand on the duct, the movable flange there, so that he can guide and keep the airflow and capture right at where it needs to be. But that came through some training and some observation and some coaching.
Some strength exercises.
Some strength exercises.
That may be an ergonomic hazard.
Yeah.
So we can discuss that in another.
I'm also a little concerned that he maybe doesn't have both hands on that grinder.
To stabilize it,
right? So these are just elements that we do want to be looking at. While we're trying to control one hazard, we might create another. And so this is still something that needs more evaluation. So this is a deeper dive into that study that we just mentioned. And you can just sort of see from this table, if we go to the box that says mean, you can look at the average exposures to RCS, and this is over just a 30-minute period of time while they were doing a very specific task. And this, you should note, is in milligrams per cubic meter of air, not micrograms, right? So we're going to change that by a factor of 1,000. Mm-hmm. But you can see if we wet the blade, we're just about 5 milligrams of respirable crystal and silica in that period of time. That's pretty high. When they added the water curtain together, that drove that down a little bit to 3.8 milligrams. But when they added in the local exhaust ventilation and the wetted blade, that we got a really significant reduction there. You can see at 0.6 milligrams per cubic meter. Compare all of those, if you will, to completing that cut dry, which generated 44 milligrams of respirable crystal and silica dust in 30 minutes, right? Which is almost 1,000 times the current Pell.
And I just want to point out that I review a lot of reports that we do when we do OSHA consultation and we go out to countertop manufacturing companies. And these results are not far off from what we see.
Yeah.
And it's quite alarming when I see results that are extremely high. The first thing I do is I ask the consultant if they were working with engineered stone. It's pretty daunting to think of this, that even with both wetted blade and local exhaust ventilation, there's still 12 times the permissible exposure limit. And that's a tremendous amount of exposure and very troubling.
Yeah, and I think highlights, again, why when we are working through the hierarchy of controls here, we need to look at this and understand, even when we're using sort of the best technology that's available to us currently, it might not be sufficient to be protective, and we really need to look at adding in respiratory protection of an appropriate level. The third strategy to address are ventilated enclosures, and this would be considered isolating the worker or exposure from other areas. And NIOSH did do some field testing of this particular type of control strategy, and so there's this booth, right, that got created, and a very specific air handling unit attached to it, supply air coming in and then that air being filtered out, and you can see the position of the individual against sort of the bank of 6 filters there sort of behind him. The results from this were still exceedingly high. They were well over 3 times the PEL, even though they were 75% less what they were when there wasn't a dust control booth put in place. So they did see a marked reduction in exposure when the filtration unit was on, but still not enough. The other thing that we see regularly with regards to sort of these enclosures or booths where people might do some of the fabrication work is although the air handler that they've got set up there might pull enough air, these rooms, these small rooms that get created, they also become kind of like a catch-all for other things. And so boxes get put in there or other things get stored in front of the air handling filtration, or the employee moves their body around in a circle around the fabricated piece. And so they're putting their back to the filtration unit, which means as they grind or polish, all of that dust that's generated just gets drawn right through their breathing zone as it's trying to be exhausted out of the booth. So booths can be useful for certain applications, but they require a lot of maintenance and training and work practice changes with regards to body positioning and what gets put in the booth, making sure that we're not blocking the filtration units during the dust generating activity.
And also that you develop a filter changeout schedule and you monitor the flow rate of the air being pulled through. And that's what we see a lot of times is people have filtration systems that worked really well initially, but by the time we get there, they do not have appropriate filters and they're not pulling the appropriate amount of air.
So our fourth thing that we wanted to address, just because it's come across, our radar screen through some of the materials that we've referenced already, that we wanted to highlight here, is cleanup. So under the OSHA regulation, there are certain methods for cleanup that are prohibited, right? This is going to include anything related to dry sweeping or use of compressed air, especially use of compressed air if you don't have some sort of ventilation capture to gather and exhaust all of that dust that's going to get re-entrained into the air when you do dry sweeping or compressed air use of unsettled dust. So a business owner who participated in the NIOSH webinar, Jonathan Mitnick from CCS Stone, he spoke to the cleanup methods that they have implemented at their facility, and wanted to share them here with you because they were doing their cleanup typically wet. As you know, from the middle picture there, this is very common to what we see at a lot of the stone fabrication shops that we go to, right? An employee will come and they'll hose down the floor and they might squeegee it a little bit, or they might use the force of the water pressure to drive water towards a floor grate. And then that will dry overnight. And what they were finding at CCS Stone anyways there and Slabworks in Montana was that that residual, as it dried overnight, would then leave a fine layer of dust on the floor. And then when folks would come in the next day and they'd start moving things around the shop, all of that dust would go back into the air. And it would not just affect the fabricators, it's now affecting everybody in that space. So they've moved to floor scrubbers that you can rent, that have water filtration, will suck it back up, and they saw sort of really a marked decrease in just the residual amount that would enter the air the next day. Beyond cleaning off the surfaces and the floor and the equipment, we wanted to highlight,
it worked earlier.
Cleaning off personnel, right? And so we'll see if we can link over here to it. They were embedded, so you should be able to watch them yourselves. Just a couple of YouTube videos that highlight what it is to brush yourself off at the end of the day, right? With your hands, and how much dust is going into the air then, and the difference in hands versus use of compressed air potentially. Hopefully you can see these two. These are both common practices that we see at a lot of the facilities that we go to in a lot of different industries, but especially in stone fabrication. So those are two ways that we want to see you not cleaning yourselves off at the facilities that we go to.
Hold on a second. I think I need to think another video.
Oh, it's auto playing the next video.
I'm gonna pause this for a minute while I fix myself from sharing extra YouTube videos. I apologize for that. There we go. And I need to share. Let's see here while we pause for a minute. Let me see if there's any new chats. No, we don't have it, but we do have some direct messages, and we will respond to them later. And I am going to go back to sharing.
Great.
Thanks for dealing with our technology capabilities.
We're doing just fine.
All right, here we go.
All right. So the next thing we need to address then, right, because we've touched on it, and in a lot of the photos you may have seen it, is respiratory protection, right? We refer to PPE and respiratory protection as the last line of defense, but I think when we're talking about engineered stone, we're going to talk about it as an integral part of adequately protecting people in the workplace until we can get a better reduction using our engineering controls. So a lot of times we get asked or we get pushback on, when do I really need to have a respirator program? So here's the 3 times you need to have respiratory protection, all right? If air monitoring tells you, right, that you need respiratory protection, then you need respiratory protection. And there was a recent U.S. Court of Appeals decade-long court case.
Really long court battle, and it clearly came to the conclusion that if you don't know what the air contaminant exposures are and you're wearing respiratory protection, then OSHA has every right to cite you under the standard for not having quantified the airborne concentrations. So that's really critical to the mission of getting people protected, is getting that air monitoring to see what the exposures are, so that you want to make sure you're in the appropriate respirator. There are some conditions that we've been at granite countertop and just different types of countertop companies where we've actually, the exposures were so high they needed to be in a full face respirator or a powered air purifying respirator. And so if you just have them in an N95 filtering face piece respirator, that wouldn't be adequate.
So if air monitoring tells you so, or as in that quote there, sort of your reasonable estimate of employee exposure is going to include a respiratory hazard, then we need to be truly identifying what that is and at what level. If, as an employer, you require your employees to use any type of respirator, again, like Jenny mentioned, maybe it's just a disposable dust mask, in quotes. You can't see me, but I'm putting that in quotes, right? Or a disposable N95, or you don't have air monitoring data and you said, we're going to just require respirators no matter what in the interim. If you are going to require a respirator to be used for any reason and for any duration, it can be 5 minutes. It doesn't have to be a full day. Respiratory protection and a respiratory protection program is now going to be required to be implemented. And then there are certain standards that require the use of respiratory protection. And the silica one is one of those standards under certain conditions. So we'll get into that a little bit more. For those of you who don't have a respirator program, or if you're unfamiliar with what a respirator program means, it's this bulleted list here where we're going to identify that it's a written program. There has to be an administrator identified. There are certain selection procedures that need to be adhered to. Employees have to be medically cleared to wear a respirator. They have to be fit tested, which means that they're actually challenged with a non-toxic agent, or the concentration inside their respirator as compared to the concentration outside. Those are 2 procedures that could be completed, because the goal here is to make sure that it's not leaking, right, when they put it on, that they're actually achieving the protection that we are expecting them to. Employees have to be trained, and there's got to be some procedures in place for cleaning and maintenance and storage, and how to use it. If all of that is new to you and you don't know where to start, we're going to highlight some resources for you at the end of this presentation on how to start the implementation of a respirator program. We want to come back here again to our visual of trying to understand a little bit about proper respirator use. Again, remember, we're talking about things that are millionths of a meter in diameter. That's the particle size that we're talking about. And so here, if we had our human hair, right, between 60 and 100 microns across in diameter, we're talking about things that are in that, sort of 4 to 10 microns across in diameter. And so if you had a single human hair, right, and let's just imagine that single human hair is on your face, and then you put a respirator on, we now can have a better idea of why facial hair is such a pet peeve of us in the safety and health field, because hair breaks the seal of the respirator against the face and is allowing these very tiny particles that you can't see to make their way in past the respirator that you're assuming is protecting you and right into your lungs. So the guy here on the right, you can clearly tell he was wearing a respirator. You can see the work that he was doing. You can see it on his eyelashes and his hat and his cheeks, and you can see right around his nose and mouth that he looks like he was fairly protected, right? Because you don't see any of that white dust residual. But the reality is, again, we're talking about dust particles that you can't see with the naked eye. And so if you have the amount of stubble like this gentleman did, you know that there was hair interfering with that respirator seal, and that those dust particles were making their way to his lungs. So how do we select the right kind of respirator? You can see all the different images here of different types of respirators that are out there, and the ones that we're talking about specifically with regards to protection against silica are ones that are equipped with filters, okay? And so the picture on the left, which is the filtering face piece, that whole thing, right? Some of us know that as a dust mask or an N95. There's all kinds of different ways we refer to that particular respiratory protection device. That whole thing is the filtration media, right? And so it's collecting particles as we breathe and hopefully collecting them on the outside. But the rest of the images that you can see here, those filters are replaceable on all of them. And the thing about filters is that they protect against particles, not vapors or gases. So if you had folks in a fabrication shop that were also using epoxies or glues or flowing, or cutting solvents, those are going to be releasing vapors, and this type of filter doesn't protect against those. So that's a different type of selection process that you would want to look into. But with regards to silica, here's the sort of different devices that might be appropriate, and how you pick the right one depends on how much is in the air, determines what respirator you need. So you can see on all of these, they have a little thing called an APF, which is the assigned protection factor. And that is the protection value that's given to a different category of respirator and means it's going to provide the wearer protection up to a certain concentration of contaminant in the air. So an APF 10 respirator, and there's two here on this slide that meet that criteria, provide up to 10 times the PEL, so up to 500 micrograms per cubic meter of air, respirable crystalline silica in the air, all right? A full face respirator, like Jenny mentioned, that's got an APF of 50. Then you've got these illustrations here for a powered air purifying respirator, and those come in two different forms. There's sort of the loose fitting one and the hood powered one, and they start at an APF of 25, but if you have evidence from the manufacturer that they've done appropriate testing, in some instances that APF can go up to 1,000. So it can be much more protective than a full face respirator and a lot more comfortable to wear. And you can have facial hair when you're using one of those devices.
And if we go back to that one slide where we talked about the study that was 800 times the exposure limit, the only one that would be applicable here is that hooded powered air purifying respirator.
Absolutely. So what about dust masks? You can see it visualized here. I guarantee that if you're a business owner, you've got a box of these out on the floor, whether you knew it or not, because that's our experience anyways. Most of us have them in our own homes, right? These disposable N95s that we call them, and that just means that they provide up to 95% of efficiency. You know, do they get removed particles of a certain size up to 95%? And they're disposable, and that's great. A lot of times people will argue with us that dust masks, these N95s, these throwaway disposable things, aren't respirators. And so we wanted to include two things here for you. OSHA's definition is a filtering face piece or a dust mask is considered to be a negative pressure particulate respirator, and the filter is an integral part of the face piece, right? The whole thing there, the face piece is a filtering medium. There's a couple of letters of interpretation that are on OSHA's site. We've linked to one here that also helps spell out and clarify why this is considered to be a respirator. And what that means is that if it's considered to be a respirator, then we need to go back to that slide that says, well, if I'm requiring the use of that, what do I have to do? And yes, the answer is you would implement a full respirator program if these are what people are mandated or required to be wearing. They do provide up to 10 times the PEL. They have an APF of 10, just like the half mask respirator that has the exchangeable filters on it. So the last little bit that we want to touch on with you is a final element of the OSHA regulation, which is medical surveillance, and medical surveillance for general industry settings, and specifically what we would be recommending at this point for those of you that work with engineered stone. In the NIOSH webinar that we attended, you know, this visual here, sort of what can employers do? They're encouraging, and this was out of California, is yeah, if you know that you've got people that are working with this material and you have not yet implemented a medical surveillance program for silica, you want to start now. And so that is performing a screening with respiratory symptom questionnaire, getting a chest x-ray or a CT scan for folks, and getting some lung function testing completed so that we've got a baseline. The general industry standard that was developed here by OSHA is that it was sort of a phased-in time approach. And so we've got just about 6 months or so, 7 months, until we hit June 23rd, 2020. And so if we haven't implemented a medical surveillance program in our facilities yet, we've got sort of another 7 months or so where if we know that we're over the PEL in our facilities more than 30 days a year, we need to be making medical surveillance available for folks and really encouraging them to participate. Once we hit June 23rd next year, that switches to a lower level. That's going to switch to the action level. So at 25 micrograms per cubic meter of air instead of 50, those folks, everyone that exceeds the action level also need to be enrolled into a medical surveillance program and have it offered here. You know, the thing that we want to be highlighting is that intensity and duration, right, of the work that's being performed in these shops influence health outcomes. So if we know people have been working for 10 years with engineered stone and maybe we didn't do it wet the whole time, or maybe we haven't been having people in respiratory protection, at this point, we know that those folks have had some really massive exposures, and so we want to be getting them into medical surveillance really as soon as possible. And what they're looking for here is accelerated or acute silicosis, taking a really complete work history, talking about PPE use. The OSHA regulation under medical surveillance also includes tuberculosis testing and pulmonary function and spirometry testing, and any other tests that the licensed healthcare practitioner deems necessary. Maybe they would look at kidney function or talk to folks about some of these autoimmune illnesses that they might be having symptoms from. And that, as a reminder, under this regulation, the employer is going to cover the full cost of medical surveillance. That includes the exams, any of the tests that are performed, that are required, and the time that an employee might have to be away from work to go and get those completed. The standard is written as such that medical surveillance needs to be made available. That's the language that's used. And you can't, under the regulation, necessarily force an employee to participate in medical surveillance. They could decline, but it really needs to be very clearly explained and documented on the part of the employer that the due diligence has been performed to say, this is available. We want you to participate in it, and here's why. So that they really understand, the employees understand that this is for their benefit. Just as a comparison, in Australia, the government sort of equivalent of OSHA here inspected all 138 workplaces known in Queensland to work with engineered stone. And then they mandated health screening of approximately 800 employees that they paid for out of WorkCover Queensland, which is another government agency. 50% of that screening has been completed so far, and to date, 100 employees have tested positive for silicosis, and 15 of them have progressive massive fibrosis.
And we are not going to get into workers' comp or any of those other topic areas, but it is a huge liability to be putting a mask on somebody's face if their lungs are not healthy enough to breathe through it. And I just strongly encourage, we get a lot of questions, I field a lot of questions, really hemming and hawing and dancing around that made available phrasing. And it is in your best interest to encourage, strongly encourage, require, make available and promote this medical surveillance.
Yeah, the best practice is absolutely to go beyond. And just because there's nothing in the regulation that says an employee has to participate, it is within an employer's right to make that a condition of employment. So you, as an employer, you can absolutely go ahead and say, this is an absolute requirement for working at our facility. Here you can see sort of some of the questions and symptoms. We looked at this earlier, but I did want to include it again here and reference the sample forms that go to the physician, and these are in the small entity guide document, and we'll have the full link to it at the back as well. But some of the stuff is, you don't have to create it from scratch. You don't have to try to parse apart really what am I supposed to do as an employer or what am I not. The small entity guide has really got some very excellent guidance on how to start a medical surveillance program specifically for your employees. One of the last things here that we wanted to just bring up, because we'd be remiss if we didn't, regarding a lot of, when we go out and do inspections at stone fabrication shops, it's not just silica that we're often looking at or see. There are other things that we just want to draw attention to here. Noise exposure for the polishers and the grinders especially. We've done simultaneous noise and air monitoring, and those folks are always over OSHA's action level for hearing, needing to be included in a hearing conservation program. So noise exposures are always typically over 85 decibels as an 8-hour average for folks that are doing polishing. So that's a whole nother program that needs to be addressed as well if you haven't. A lot of times we'll see PPE, like safety glasses, not necessarily being used properly. Right. In the winter months, oftentimes the forklifts might be moving slabs around and left idling. There can be concerns about carbon monoxide. Typically, we will see people using respirators, whether it's voluntary or required, but we will see them being used improperly. So straps cut off or pulled down below the nose because they're interfering with the safety glasses. We'll see people with facial hair. We'll see them strewn all over the shop so that they're not being stored appropriately, and it just means they're collecting dust that then people put on their faces the next day and breathe in. We typically see a lot of deficiency with regards to education and training, that the hazards aren't addressed sufficiently, that there isn't much on respirator training, that we're not necessarily giving enough training on some of the hazards related to clean up of both equipment and personnel. So back to that sort of brushing off of dust or use of compressed air. And then certainly, because of the amount of water that's being used at a lot of these facilities, electrical hazards are a big one that we want to make sure folks are mindful of. Lots of slip, trips, and fall hazards, not only because of the wet environment, but because of the hoses and the cords that are typically all over the floors. And then the hoists that are often used to move big slabs onto the saws or the CNCs. Those just need to be inspected. There needs to be some procedures around those. I can't help but also note that we are in the era of do it yourself and YouTube tutorials, and these are just two images that I pulled off of online where this guy in his garage wanted to show everybody how to do it yourself. And he's got on the guy on the left here's got great hearing protection, and he's wearing a respirator. I'm pleased, and he had a beard. I'm not sure, he had been medically cleared or fit tested, and he had on face shields, but he was barefoot. So that was really remarkable. And then the guy here on the right, here, all about using grinders in different ways, and you can see the particulate in the air. So this is one of those things we just want to say, please don't try it at home. The remaining slides that are here are just links to resources that we've put together for you. Videos on how to cover health hazards with your employees, the OSHA standards. That top link there is the Small Entity Compliance Guide, which is a fabulous document. The frequently asked questions list answers some of the things that I'm sure you're probably asking at this point. The Natural Stone Institute, even if you're not a member, they've got training materials on their site, so I included those there. There are letters of interpretation now published on the OSHA website specific to silica, so those two are there. And then the respiratory protection, how do we put a program together? The Small Entity Guide for Respiratory Protection, that first document there, has got some really invaluable resources. There's videos that OSHA has produced that are both in Spanish and in English that show the process of fit testing and how to check a seal and what does fitting look like, or what's the selection process. So those are also available and in a different language too. Additional training, OSHA's got PowerPoints that are available. They have a whole page that's dedicated for written program development. There's on page 13 of OSHA's Small Entity Compliance Guide for general industry, there's a model on how to put together a written program for yourself at your facility. Online, silica-safe.org. While they are primarily construction focused, they've got some really excellent resources and a template that you can use for program development. Additional literature, these are just, if you wanted to get more into the research on it, those are some links to a few additional articles and studies. And our final thoughts here, I think, is that when you're seeing 29-year-olds with kids and a whole lifetime ahead of them say, I can't even work anymore, I can't even go up the stairs to my house, and I know that I'm going to be missing out, but I don't know by how much yet. This is what we're trying to prevent. And so we encourage you to continue to reach out to us. If you're here in Georgia, that top oshainfo.gatech.edu link takes you directly to our small business consultation page. If you are joining us from elsewhere, there's consultation programs in your state as well, and that second bullet would take you to the directory for how you would access your consultation program in your state.
All right.
And so that's the conclusion of what we've got to say, but we would love to hear or answer questions if you have some. So you can type them into the chat box, unless Jenny can make the phone work so that you could also call them.
So I do want to start off by answering Beatrice's comment. If you go up to the top, we have the PowerPoint through a link up in, it's like a Dropbox link. Please let us know if you didn't or were not able to access them. I'm typing my email address into the chat so that you can email me directly. And that is a great recommendation to create a checklist or workflow chart for the employers to use. We have a consultation emphasis area within our OSHA consultation program for silica. And so we can certainly make that a priority. And we will be we're recording this video, and I am going to do my best to download it from Blue Jeans and transfer it to a freely shareable mechanism. So that
should go on our website.
Yeah,
probably.
we'll put it on our website. So that's there. If you go into the area where it says people and you find your name, you can uncheck how I muted you, and you can jump in to ask a question if you have one. And we'll keep monitoring the chat window. Maria asks, what do you consider a short period of time? Are you referring to short times during the day or short time performing the work? It's kind of both. I think what we find is that a lot of employees end up going from task to task, and some tasks are more hazardous and dangerous than others. So we've got that element. The epidemiologic research that's being done is really showing that when you assault the lungs with a really high level of exposure all at once, the biological response is so much more extreme. So when we talk about a short duration of high level of exposure, we mean not only like 30 minutes with no ventilation, no water, totally dry. That is a short duration, but then also talking about it more abstractly, like where we would wait 30 years to see silicosis develop. We're seeing it in a very abbreviated form, and to see a 29-year-old dying of silicosis is really horrific. It's horrific at any time, but really horrific then.
The thing I would add to that is our focus here today was during fabrication, right? So actually at a general industry, right, category facility, where the template's been made in the field, the measurements got made, and they brought those back to the shop, and then the piece was made and cut down appropriately, and then they go and it's going to get installed, and that is a different category. The goal, the hope is that once that the measurements were made correctly and it gets itself out to its final resting place to be installed and no adjustments need to be made. That type of installation is now sort of considered under a construction activity. So the construction standards for silica would apply. And although those folks shouldn't have to make adjustments, in talking with those installers, oftentimes there are slight adjustments that have to be made in the field, right? Like they were off by 1/8 of an inch or a 1/16th or a 32nd, and they're going to have to shave off a small piece in order for it to fit correctly. And so they're not discerning that until they're in place, oftentimes. And if they're in someone's home, they're not going to want to put dust everywhere, and they're also not going to want to put water everywhere. And so one of the things that the Queensland's folks referenced, and they had pictures of, was individuals in a residence under plastic sheeting with the saw making that trim. So they were trying to contain the dust so it didn't go all over this individual's kitchen, but now they're in this space with a highly concentrated toast. You couldn't see them by the time they were done making that tiny small adjustment. So that would be another one of those sort of short times, unexpected exposures, but that also is falling outside of what we were talking about here today. We were really talking about fabrication, not installation. I haven't been able to find any information about the installation part of engineered stone. We've seen it with natural stone, and some of those exposures can be high for those folks, but I haven't seen it for engineered. So that's another area potentially of research that we could look into. But most of the time, short duration, like Jenny said, is sort of those, oh, it's only going to take 15 minutes, it's only going to take 5 minutes, it's only going to take 30 minutes. I think what they've found at this point is that anytime that's being completed dry, even in just a couple of minutes, you will well exceed the PEL. I mean, within just a couple of minutes. So just something to be mindful of when we're asking questions about how tasks are being performed.
Any other questions? Just a couple more points I wanted to make. We are in the South and it is hot. And one of the things I've seen a lot lately when we go out to countertop manufacturing plants is that they have a lot of fans. And oftentimes the employees will place the fans so that they're blowing on them. And I have some video footage of those fans blowing the water and everything else directly onto them. So it's emphasizing and exacerbating the exposure for the workers. So I think that's another area that when we're looking at it, we have to look at the comfort of the workers. And if you're putting them in a respirator and all of these additional personal protective equipment items, but you are in a room that is not temperature regulated, and they're uncomfortable, they are going to do first and foremost what makes them comfortable immediately. Yep. And so taking off the respirators, using fans, those sort of things. So I strongly encourage looking at some of the newer versions of powered air purifying respirators. They are really nice, low profile, and they bring in some cooler air to the workers and help make it a little bit easier for them and comfort as well.
And we know that most of the places we go to, the individuals there, they want to have beards or they have facial hair, and that can be a challenge over and over again. So coming up with respiratory protection that is comfortable, that allows them to have facial hair and it not to be an enforcement issue out on the floor over and over again. And in a good number of those, that's also then going to provide the face and eye protection all in one. So you don't have to have safety glasses and a face shield and the respirator, right? We're sort of reducing the burden on the individual at the same time.
Tanya, that's a great question. She asked, are there any consideration regarding fillers? There was an AIHCE presentation regarding aluminum exposure dealing with countertops. We have done very minimal, to be perfectly honest, monitoring related to the fillers. We are normally focusing on them getting us the safety data sheets for the fillers. That's normally our biggest challenge is like, do you even know what this stuff is? Yeah. We see them. We also see fillers have a lot of isocyanates. So I've seen like these two-part epoxies that they, if there's a crack or if there's something that needs to be repaired, they're using some adhesives that include isocyanates. So that is a great point, Tanya, and we can potentially maybe do some monitoring next time we see, and I'll look into that AIHCE abstract to see if we can get more information. Anybody else? Call for questions. We appreciate you being on the call and dealing with a couple little minor technological snafus. And also, we went long, which is okay because there's a lot to be said. Just for those of you that own small businesses and you are in the state of Georgia, we at Georgia Tech have the Georgia Tech OSHA consultation program. I don't think we properly explained what OSHA consultation is. It is a free, 100% free service that is funded through state funds and through primarily 90% federal funds. And through that, we are able to go out to companies and provide on-site consultation, including air monitoring. And so that is a huge resource for you. We can sit down with you, go step by step about consultation. And if you go to our website, which I will include in the chat, it's also in the slides, you can request that service.
You left out the most important part. Besides it being free, it's not enforcement.
Right.
Okay.
We don't have to issue fines. There is a catch. There is a catch. If you do not correct the hazards we identify, we do reserve the right to turn you over to OSHA. However, that said, we do our very best to help guide you through this process, hold your hand, explain to you what needs to be done, and really help you get towards compliance. So that is one element. If you were to be inspected by OSHA, and you go to the settlement hearing, or I'm blanking on what it's called, where you meet and dispute your citation.
You go to your conference.
Yes, the informal conference. That's what I was looking for. You can ask to be able to use consultation as part of your settlement agreement. And we do a limited number of abatement assistance where if you are cited by OSHA for exposure to silica, we can come out and assist you with the aspect of getting your silica sampling conducted. So I recently went to a company and did just that. And in that situation, we come out, we do air monitoring. We very much focus just on getting you to answer those OSHA citations. That's all we're allowed to do at that point in time. And then we can come back later and help you from start to finish.
Or you can ask for a start to finish one from the get-go and look at both safety and health hazards. We have teams that do both, and that's what happens in every state. So it's a service that's available, again, to small and medium-sized businesses. So as long as you're in that less than 250 employees on site sort of category, you are eligible for the free consultation service in your state. Thank you all for your time, and you have our contact info, so if you have additional questions, please feel free to reach out.
Thank you. Have a good day. Bye-bye.